Welcome to the Advanced Women's Health Podcast, where we empower women with the latest insights and advice on holistic health. From cutting-edge medical research to practical wellness tips, our mission is to help you thrive at every stage of life. Join us as we explore topics ranging from hormonal balance and reproductive health to nutrition and mental well-being. Whether you're seeking solutions for a specific health concern or simply want to enhance your overall wellness, you're in the right place. Let's embark on this journey to better health together. This is the Advanced Women's Health Podcast. Hello, everyone, and welcome back. Today we have Dr. Aless with us. We are going to be diving into all fun things related to hormones and mental health and all that fun stuff. But before we get into that, I would love for you to take it away and introduce yourself and let us know why you got into naturopathic medicine, and we'll go from there.
Absolutely. Hi, everyone. I'm Dr. Aless, Dr. Alessandra, and I'm at Advanced Women's Health online, virtual, and also at the Danforth and the Port Credit locations. So how I got into naturopathic medicine, I must say that integrative health was always kind of a part of my life. Growing up, I never knew the difference between conventional medicine, so what our medical doctors would recommend to us, versus natural medicine or naturopathic medicine. I was always taking natural things when I had a cold, if I had a pain, any sort of ailment. My parents really forced the natural therapies first. And then if that didn't resolve, of course, antibiotics, Advil, Tylenol, all that good stuff as well. I remember there was one cold medicine that I took as a child and it tasted so good. And I would always kind of get excited before I was cold. It was called, I still struggle with the name. It's like osculinum.
Oh, yeah. I don't know how to say that either. Yeah. My kids take it.
Yes. It's the homeopathic. And I remember being in the kitchen and my mom gave me like the vial of the little pills. Beans. And I took it and was like, this is awesome. Like, I want to be sick all the time if I can take sugar.
Someone told me it was oscillococcinum or something like that.
Yeah, that's.
I know. I never know how to say it either. And it's funny. My kids will not take the little balls. That's like how absent sugar is from their lives. They will only take it diluted in water.
Oh my God. No, I was like, give me the tube. I will, because it comes in like the little packs. Yeah. So that was kind of my first memory. And
sugar was your first memory of natural health.
I honestly, I remember being in naturopathic medicine school and seeing this box of this like osculinum on the shelf at the health store. And I was like, oh my gosh, this is what I took as a child. I had never seen this anywhere else. So I had always thought the two were just one medicine. I didn't know that people grew up not using natural therapies. It was so integrated in my life. And then, beyond that, in my undergrad, I did kinesiology. So still in the health realm, but more physical health. And I think I just realized towards the end, what I thought I was going to go into was the physiotherapies and occupational therapies, but something was missing. It was not that whole health I wanted to give my patients. So.
Very cool. And so then how did you find out what NDs were? Because obviously to your parents, it was the same thing. So like, what did that look like?
Yeah, absolutely. So when I was in high school, I had pretty vague common symptoms that I think a lot of people had: anxiety, depression, fatigue. And my mom had seen a naturopath. I think she saw her at like the running room doing a webinar. She's like, you should go see what this is all about. And I started seeing her, and it was my first real experience seeing how natural medicines and naturopathic medicines can really benefit us and like change our health. It wasn't just drink this tea if you're sick or take some vitamin C. It was, these botanicals. These supplements can really alter your health in a massive way. So that was my first introduction to naturopathic medicine. And I'd never really thought about it as a career until the end of my undergrad, when I was still seeing my naturopath. And I explored that with her and got to see another side of the profession that wasn't just my own health concerns, but the amount of conditions that we can treat, which I think to this day still I get in shock. Like every time I have a patient and I'm like, okay, let's like do X, Y, and Z, and the amount of benefit they get from it. And they come in, they're like, I feel so much better. I'm like, this is amazing. It's wonderful that we can do this with natural therapies.
And I think that's the fun thing about being in practice so long. And like, that's what I love about the mentorship piece of our team. As a newer grad, I think it's Like you are surprised. You're like, look at me go. And now it's almost the opposite for me. Like I have seen thousands of people, whether personally and through mentorship and through you guys. And I'm like, that didn't work. You know what I mean? Like I'm like shook if people are less than 50% better. And I'm like, what is wrong here? You know what I mean? Like what happened? What disconnect? So you're right. Like I think for so many people, there's still this construct of doubt. And you know what? It's not even doubt. How could it be that simple? Like disease seems so complicated and so overwhelming. And like from a research perspective, I could map out 23,000 pathways and cytokines that are going to get you to endometriosis or PMDD. You know what I mean? But the solutions can actually be so elegant and so simple. And it's so hard to believe that.
I could not agree with that more. I think I talk about that a lot with my first appointment with patients, is that health can be complex. And I don't want to dismiss really hard conditions that people are going through, diagnoses. But at the end of the day, I want to make it as simple for you as possible so that these changes are sustainable and your health isn't a huge stressor in your life. Like I want this to be something that you look forward to working on and not, oh, I have to take my supplements or I have to go work out. I want patients to have that positive outlook on their health. So yeah, I couldn't have said it better. I totally agree.
Yeah, like when I don't take my supplements, I'm like, where? Supplements. Like I went to Severity and I forgot one of them. And I was like, does anyone have this in stock? Like I was like looking at the different clinics to see what we had because that's the relationship you should have with supplements that work, right? You shouldn't feel like you need to be on them for the rest of your life. But when you're in treatment, you should feel a difference from them and you can. And I think so many people have also had subpar care. Like I'm going to go out and say it. It's just a reality. There's a lot, like I have so many of my great friends. I'm like, I'm not treating you. And then they go see someone else and I'm like, I'm treating you. Like, no, this is not how we do. And I think that's the thing I find so beautiful about Advanced Women's Health is like we have a group of people that have come together around a passion for mentorship, but also a passion for excellence, right? This like degree of, I think we all deeply know that we can do better. And what we have is enough, but there's also a healthy striving towards doing better. Right. And I have been in practice for a very long time. As we have established, I still have that. That's why I still teach. That's why I still mentor, because it's almost a curiosity. And I think as a practitioner, because there are going to be practitioners listening to this, because let's be honest, you guys stalk me. No, I'm joking. Love you. But from that space, when you lose curiosity, your practice is done, in my opinion. Mm-hmm. And we're a group of people who are wildly curious. And I think that is a uniting value. Like that is literally a uniting value that we have at the clinic.
Yeah.
But it's also something that allows us to continuously simplify our protocols and amplify our result. Like that is the sign of a protocol that can be successful is one that you can maintain, one that feels sustainable, one that you feel change on, and one where your practitioner can spend the time to explain to you and you can understand it. Mm-hmm. Because it's also so important to professional, empowered, intelligent women that you don't just sit there and take something because someone in a white coat told you to do it. When you deeply understand how that's going to impact your body, there's so much power to that.
100%. There's people coming in who in their first appointment, I ask them, what's your experience with naturopathic medicine? What's your opinion? I know there's a lot of myths, a lot of like, you're going to get rid of my gluten, my dairy, and my coffee, everything that's good in life.
You're going to cut my joy.
Yeah. And they obviously come into the appointments feeling very dismissed, unheard. And then by the end of the appointment, I think 9 out of 10 people tell me, I feel so much better already. I feel heard. I feel like we're going to get to the bottom of things. And then they come in for their second appointment and they have a notepad and they're taking notes on everything I'm educating them on. And they're like, okay, what did you say about the insulin and the glucose? And it's so nice to see. Yeah. Understanding their health is something that I think is super undervalued. And if we help patients with that and help them from that education piece, the treatments and the suggestions are going to be sustainable. People are going to want to do everything you're telling them. So
1000%. I love that. I love that. I love that. So then tell us a little bit about what conditions bring you joy. So you've got all those people in your office. You're so excited. You're educating them. What are the ones that you're like, my heart is on fire. I love this.
Definitely endometriosis, PCOS. I see that a lot in the clinic, especially recently. And those bring me joy. I get such good results for patients with those. So aside from that, though, PMS, PMDD. Yes, I love mental health in general. I'm a big mental health advocate, and I think it's at the forefront of any concern. Anytime we have patients coming into advanced women's health, I know that all of our practitioners are talking about mindset and just like positive psychology. So PMS, PMDD blends the best of both worlds. It's the women's health and it's also the mental health. I get to talk about all those good things with my patients. So those are the ones that bring me joy. I have a passion for brain health as well. When I was in school, when I was in naturopathic medical school, my mom suffered from a subarachnoid hemorrhage, and that led to her having a stroke subsequently. And very lucky that she's still around, but watching the healing of that and being there for her through it has given me this admiration for the brain. And like we all know, it's a super important organ, but the amount that it can transform your health alongside the mental health component is huge. So yeah, the PMS, PMDD, anxiety, depression, those are the things that I absolutely love working with.
Amazing. Yeah. So then when we're talking about PMS and PMDD, they're one, wildly dismissed, and two, not supported in a way that I think is acceptable. I'm just going to put it out there in the acceptable way. We talk about detoxing estrogen and giving someone some B vitamins and some magnesium and telling them that everything should be fine. Mm-hmm. So walk me through what that conversation looks like for you when you're talking to patients about PMS, PMDD. How do you know you've crossed the line from one to the other? And what's going on? Because again, I think when we talk about like, oh, it's just estrogen's fault, we're yet again making a woman's hormone that is healthy and natural and normal an enemy. So walk me through kind of how you navigate that with patients, because it's such an important, large conversation.
Well, I think we're so lucky at Advanced Women's Health that the patients who are coming in have done the research. So I get a lot of patients who come in, they're like, we need to check my estrogen because I'm having some severe mood swings half the month and I can't function. I can't go to work. I have to take time off. So for me, those lifestyle things that people have to adapt to before they get their period. So yeah, the taking time off work, the severe mood swings. So as soon as we shift from some low mood, some anxiety to maybe some suicidal ideation, suicidal thoughts, feeling really irritable towards our partner. A lot of patients who come in, they're like, well, I think I'm irritable, but if you ask my partner, they probably would take that to another level. Like irritable is not enough to cover it. So those are the distinction of severity is what I'm looking for from like a mood perspective and lifestyle choice wise. But beyond that, we can look at the estrogen more so in practice, though. I'm finding that's related to our blood sugar, insulin, histamine. Mm-hmm. That is the culprit that I'm finding time and time again. So educating patients around like, yes, could be related to hormones, but let's investigate this first because it's a lot more prevalent, at least in what I've seen. And there are lab tests that we do to evaluate for those things. So just like we can test our hormones, we can test what our blood sugar is doing.
Yeah. And test inflammation and test those other components like histamine. But I think the big thing is that even if you do measure hormones and look at hormones, in conditions that are symptomatic around our hormones, the hormones are up and down all day long. Like research has shown, if you take someone's blood every hour, especially in that period of time before their period comes, the fluctuations are what's causing the symptoms. So I always say it could be estrogen, but it could be that your estrogen is going high and low within the same day, which is then doing what? Triggering an immune response, changing neurotransmitters, changing your sensitivity points to all of the other changes in stress hormones and all that kind of stuff in your brain, right? So you're right. Like it goes back to what's the environment of the brain in this situation that those hormonal shifts, because like I don't have PMS. Like my husband, he should count his blessings. The only way I have endometriosis, so the only way he knows I'm getting my period is because my back hurts. And I'll be like, oh, my back hurts. He's like, it's coming. Right. But he's a lovely man, just like your partner. And so he will go out and he will like buy things. He'll be like, oh, maybe she's going to want chocolate, or like maybe she's, but he like never got that experience of PMS for me. So I have the same hormonal fluctuations, arguably, that someone with PMS or PMDD has. Now, they might have it more substantial than I do, but we could, if we monitored my blood and your blood from that space, we could both take our blood at the exact same time on the exact same cycle and have the exact same hormones and a completely different experience of those hormones. And that's because of all of those other factors that you just mentioned.
100%. Yeah. The brain nervous system aspect and the way that our inflammation or hormones and our blood sugar and internal stressors can influence how we perceive the world is wild. I'm having this conversation with patients all the time that it's like before your period, we're more insulin resistant. Our hormones are doing a bunch of wacky stuff, and it can make us perceive text messages, emails, interactions with our partner as, we're in danger, or like, oh, they're really annoying me, like more so today than usual. And oftentimes we just put that as like, oh, it's our PMS, or it's my mood swings, my mood fluctuations, but it's actually something internally that's causing this dysfunction.
Today's episode is brought to you by none other than Advanced Women's Health. If you are interested in diving in deeper to your health, if you are finally ready to feel like yourself, and you are finally over hearing everything's normal, everything's fine, and you want a deeper dive into your healthcare, then we are here to help you. We are currently helping patients in British Columbia and Ontario, Canada. But don't worry, if you're in another province, still reach out, get added to the wait list as we expand coast to coast. We cannot wait to work with you. Check out the show notes for more information on how to get started. I would love you to talk about how normalized this is, because I will say to patients, if you can read a message 2 different ways, depending on the day of your menstrual cycle, you need treatment.
Yeah.
But we have so many patients that have experienced those symptoms for 10, 15, 20 years and not sought treatment. Why do you think that is?
Well, I think a big part of it is because, as with any women's health condition, it's just dismissed as being hormonal and mood swings. And like those words get thrown out so much that we just have learned to accept the fact that before our period, we're going to get mood swings. Yeah. And, our the males in our lives have to deal with it. And it's just because my hormones are out of whack, and like there's nothing we can do about it. And it's just a normal process of being a woman. But it is not normal to have your life turned on its head for half a month before your period. Like that 1.5 weeks before, for you to have to take time off work and it be impacting your interactions with your kids. That they know, like, oh, can't bother like mommy as much this week, and she's going to get her period next week, and I don't want her to get upset with me. Like, these are stories I hear all the time, and sometimes it's not even the patient's main concern. They just accept it as like, this is my life and what I have to deal with, and they come in with other things, and I'm like, let's circle back. Let's deal with it. What did you just say? Yeah, that's not normal.
Yeah, and I think it's what you said there could make me cry on a day-to-day basis. So I'm being completely honest, because so many people are in that boat where it's like, if you let it, how devastating is it that we have been taught that it is normal by our friends? It's not even just the medical system at this point. It's like, I remember going through school and people being like, oh, our periods. Like it was like a point of contact around each other, was like a point of connection, was how bad your period was from such a young age, right? But like, how devastating is it that we have women not getting jobs, not getting promotions because they miss work, not having connections with their kids, teaching their children about emotional volatility from such a small place. Like, if you let that hit and sink, which it's almost too scary to do because of how hard that hits, it's devastating that we've been taught to normalize this. And like, just like you said, I have patients, they'll be like, oh, I'm really constipated. Can we fix that? And I'm like, how about we fix this raging moment right now? Right. Or like, I've had patients that we weren't identifying it. And then the front desk will let me know. And they'll call me when I'm between patients. They'll be like, Sarah, I need your help. Like, we had this patient that was just really dysregulated. We have a product out of stock. They're really upset about it. Like, I need you to step in. And I'm like, okay. So I go and I call the patient, and then I get on the phone and the patient realized that it's escalated and they've realized the magnitude of the problem and they start bawling. And they're like, I'm sorry. It's just a couple days before my period. And it's like, if this is happening in all areas of your life, this is having huge impacts socially, professionally, relationally. And the fact that we're being taught that it's normal is heartbreaking.
Mm-hmm.
Like, it breaks my heart. It
Yeah.
breaks my heart.
Yeah, I have a lot of patients who come in, and especially with that PMDD concern, they list how much it's affected their life. Yeah, it's a lot. It's a lot to have that much pain and like mood swings and stuff just dismissed as a normal part of being a woman.
Mm-hmm.
Yeah.
So then walk me through what that looks like for you in terms of helping people navigate out of that. Like, what does that consult look like? What are some key symptoms that lead you in a different direction? But like, there are a few different causes of PMDD. I can think of about 5 causes. What are some of the key ones that you look for in practice, and how do they show up?
Yeah, the first one I'm definitely looking into is insulin resistance, as we kind of alluded to, and some other things that we were talking about earlier. But depending on the rest of the symptoms that the patient comes in with, I'm looking for the constipation, the associated fatigue, the sugar cravings, all of that stuff, which I'm sure as people are listening are like, oh, I have this. Maybe I don't have PMDD, but I have these symptoms.
Doesn't everyone in Toronto have constipation and sugar cravings? Isn't that why the city is the way it is?
I can attest to yes.
As someone who moved out of that city, I can now joke about it. But
yes, I know. If I have patients that listen to this, they're like, she is talking about me. But no, I'm talking about all of you. So it's one of you.
It's not personal.
Yeah. But aside from like the mood symptoms that are like the irritability, sadness, weeping, those that kind of cycle through before the period, those insulin components, and then inflammation is a very big one. So inflammation can be caused by all of the above. It can be caused by dysregulated hormones, insulin resistance, dysregulated immune system. But having a lot of inflammation being present in the body can ultimately alter all of these hormones, not just the sex hormones, the thyroid hormones, our cortisol. So looking at aspects of that is going to be super crucial. Usually that's through lab work. Sometimes it comes up through things like pain. So if there's any pain associated with the period, that's a big indicator. But determining and assessing it through lab work is what's really going to help me treat the cause. That's going to help me distinguish between the different types and different causes. Those are the main ones that I'm saying. There's some hormonal stuff too, but honestly, it's so much less, I think, than people realize.
Hormones are like the last drop in the bucket.
Yeah.
Yep.
There's so many other things that, and even in terms of treatment, so many other things that need to be cleaned up first. Yeah. We can't just try to mask symptoms. And as much as I do give some sort of mood support, I want to, use our lovely botanicals and all the different supplements and things that we have, because if we aren't supporting with a Band-Aid solution, at least at the beginning, it's really hard to get that movement. You need to feel energized and motivated to make some of these lifestyle changes. So.
Yeah. And I think I'm going to say 2 things, but I think that is hugely important, right? An obstacle to coming in and an obstacle to care is being able to do the protocol. And I think coming into a naturopathic doctor's office, people are scared about cost, which is like why we're doing so much work with Advanced Women's Health across the country to say, like, here's the cost of care over 4 months. You know what I mean? Like, here's what you can expect, because people think it's going to be thousands and thousands of dollars. Like, I was talking to someone yesterday and she was like, okay, ballpark me, like, what do you think this is going to cost? And I was like,
this blood work's probably 150, 200 bucks. Supplements is probably going to be $100 a month for the first couple of months. Then it'll go down from there. You're going to have 3 appointments over a 4-month period of time. This is how much it costs per hour. And she was like, oh yeah, that's fine. You know what I mean? But people, again, think that it has to be wildly expensive, which goes back to like the simplicity conversation of it doesn't, right? But another huge obstacle is a fear around being able to do the protocol, especially when 2 weeks of the month is a write-off. So not only do you have beautiful treatments and botanicals that can help to support that, and you can take that like inflammatory haze, that like feeling of the flu before your period, we can take that down pretty quickly. We also, and I want to make this really clear because we don't even talk about it anymore because of how much of a part of our practice it is, but patients are still concerned about it. We will absolutely advocate for, support you, and never judge you for taking pharmaceutical mental health medication.
Mm-hmm.
SSRIs, SNRIs, whatever you need to take to get through that period of time while we stabilize the situation, or for the rest of your friggin' life, I don't care. That is life-saving, and we hugely support that. Like in British Columbia, naturopathic doctors can prescribe and do actively prescribe those medications all the time. We can prescribe in Ontario. It's just not in our scope to have SSRIs and SNRIs and those types of things. But like, I think we need to I want to take a moment to put that on the conversation, because we don't even talk about it internally, because it's just like, obviously everyone knows we are going to support their pharmaceuticals, but patients are still sitting there being like, I can't do this without this, right?
It's so true. Yeah, I say that right out the gate, whether it's in my first initial appointment or it's a meet and greet, that's my first encounter with a patient. I always say, as naturopathic doctors, we are not against conventional medicine. You can come in with your prescriptions, whatever you need to take to get through, and I will work with that. I will make sure there's no interactions, how we can either monitor and adjust for side effects or just, treat as is. And then what usually happens is down the line, as patients learn more and they educate from us, they start asking questions about their prescriptions. And that conversation is always patient-centered. These are the risks and benefits. Whatever you want to do, I will support you. But I will never try to push you to come off something that you very much need to get through. So,
yeah. And it's also like, I think people don't realize to get our prescribing license, we have to know these medications ins and out. And with the way the healthcare system is right now, sometimes I say to patients when we get to that point and have that conversation, okay, these are the symptoms you're having from escitalopram. These symptoms could be caused by your medication. They could be caused by something else. Maybe you don't want to come off, you're not ready to come off, or you think you're ready to come off. And I see that as like an absolute burning train going down the tracks. But we could try Wellbutrin.
mm-hmm.
You know what I mean? Like,
Mm-hmm.
And then we work with the medical doctor who prescribed the medication, and we write notes and have these conversations to say, okay, maybe this is how we have to go here. Like maybe this is another alternative. And so you're not even alone in the pharmaceutical piece of like, my doctor doesn't know how to help me navigate this right now, or I've tried these 3 and I don't know if anything's going to help. Like it's not our job per se, but it does happen in our offices. And so these are all the things that people don't know, right? Coming into an appointment, it's like, we have a lot of time. We can have those empowered conversations, and we can get out our CTC and be like, mechanism of action, right? So yeah, I think it's just really important for people to know.
Yeah. A lot of people just get prescribed things, whether they're natural or not. I've seen this. Patients come in and they say, my last naturopath just gave me a bunch of supplements, but I don't know why I was taking them. So it happens in our profession too.
Oh yeah.
But giving people that education of like, this is why you're taking it, or this is why I'm recommending it. These are the, again, risks and benefits to taking it. This is what you should know side effect wise. And it's ultimately their decision. I had this conversation with a patient earlier today that these are the things in an ideal world that could help you with your concerns. And I listed them out, but I said, this is a lot to do at once. So let's scale back. What do I think is going to be the most important, give us the biggest bang for our buck right now? And let's build off of that as a foundation. And she was like, all right, I love that plan. That's way more manageable for me in my day-to-day life. Thank you for explaining that. I'm good to go.
So, yeah. Love that. Love that. So then looping back, you were talking about we can test inflammation. What are those tests?
So we can do ESR and CRP. So the ESR is erythrocyte sedimentation rate. Really long words here.
Sexy.
Yeah, it basically just tells us about general inflammation of the body. So how our red blood cells are falling. To follow that up with, I'm usually doing a CRP, and that can give us more specific inflammation. So usually, historically, it's been tested to determine cardiovascular health, risk for cardiovascular disease, but we often use it to determine digestive inflammation and what gut bugs are growing. Yeah, so those are the big inflammation markers, often pairing that with like a CBC. So we're getting an idea of what's happening with your red blood cells, your white blood cells. Ferritin is a big inflammatory marker. So ferritin is our storage of iron. And I love testing ferritin because if we have low ferritin, good chance that we also have low circulating iron in our body. It's kind of like the cash we have in our bank. So like we can't really access it that easily, but it's in storage. But when it's really high, and let's say our iron value, so like the amount of iron that's circulating in our body is really low, that makes me think, okay, there could be some inflammation happening in the body. Our body is very smart and it knows that things like gut bugs, so like overgrowth of bad gut bacteria, love to feast on iron. So it will try to hide that iron away and then it'll put it in storage. The issue with that is that we can't access this iron. So that's a common one I'm seeing in females a lot. I love doing an iron panel for that reason.
Totally. Yeah. And so with respect to those inflammation markers, which again, like, I think sometimes it's helpful. Those markers are not wildly expensive. Like it's like 10, 15, 20 bucks. Like it's like cheap. Like, and
Yes.
it makes it so much more approachable, right? I'll say to people, if you can run ESR and CRP, these two inflammatory markers, and get an understanding of what inflammation is circulating in your blood, which is then going to your brain, which is then changing your perception of reality. And there's so much research on those two markers with mental health conditions. Like it's so, the relationship is so, so strong, and menstrual conditions. Why would you not? Like, yeah, it honestly becomes a question. And I think the reason why people don't is because they don't know, which is why we're doing this podcast and why we constantly out there talking, is because what you don't know, you don't know. But ignorance is not bliss when it comes to your own body.
Yeah. Especially if you're, coming in and you have all of these symptoms and people are like, oh, I've just learned to deal with this. Like, I didn't even know this was a concern of mine until we start identifying it and showing how things link together.
I would love for you to wrap up talking about what's one thing you wish women knew about their bodies? What's one thing that you wish women could perceive differently and act on differently with respect to their health?
Honestly, it kind of goes into what we were saying today, but I have so many women who come in and apologize for how they show up to me, whether that's in the first appointment or in the second one. Maybe they couldn't complete the plan to 100%.
Yeah.
And I want women to know that they need to stop apologizing for their health. And for
in general. Let's just put it in general.
Yeah.
Like I literally before this call, I was talking about that. The person I was talking to just kept apologizing. And I was like, don't apologize for a boundary. Just tell me what the boundary is.
Yes. All of these things we've just like outright accepted as being a part of woman.
Yep.
Whether it's, oh, I didn't shave, or, oh, I didn't complete this, or I'm still feeling crappy. Whatever we're doing, we can change it up. Stop apologizing for these things, because however you come in, that's how I'm going to treat it. All of these meet you where you're at, and you shouldn't need to apologize, especially for things that are out of your control. So things that are happening internally, you're not going to know about it until we do these tests and until we investigate further. And you're already so quick to be like, this is my fault.
And we talk about this internally all the time. Every result is a piece of information. So if you come in and say, I didn't do my plan, we're not being like, shame on you. We are saying, what's going on in your life? How could we have been better doctors for you? How could we have understood your situation better? Because it's all just a piece of information, right? It's like, okay, it was too overwhelming. Great. Now I can be a doctor for you. I completely forgot. Okay, great. We should probably work on brain fog. I didn't have enough time. Okay, let's look at where the boundaries are in your life. because you say this is a priority, but it's not. And that's not an issue. You know what I mean? It's like, I would say to people, don't judge yourself if this isn't the top priority. That's fine. It's even health isn't even my top priority. I have 2 kids. They're my top priority. But I support myself and put pieces in place to buffer myself so that I can still take care of myself and have them be my top priority. And so we can have very proactive conversations around that. And so I love that you're saying that, right? It's like the more you apologize, the less we can help you oftentimes too.
Yeah. Leave the guilt and that shame at the door. We don't need to bring that into the clinic because you don't need to feel shameful for all of these things that women are coming in and apologizing for. That is the number one, I can say, blanket statement across all of my patients. Yeah.
Agreed. Well, thank you so much for coming on and chatting with us. I think this is going to help so many people. This is why I do this podcast. I love having these conversations because people got to know you and they get to know how to feel comfortable with you even before coming in. But it's also, they can draw the line in the sand on where to advocate for themselves. So thank you so much for that.
Yes. Thanks for having me. I look forward to seeing some of you in the clinic.
Yes, we will have all of your booking info in the show notes as usual. And you can book with Aless all over Ontario. So it's going to be very fun to see how that rolls out. So anyways, have a good day, everyone. Bye.
Thank you so much for listening. I hope that you had as much fun as we did. And if you loved today's episode, share it with a friend and leave us a review. That is how we spread this message. And that is how we are going to revolutionize healthcare in Canada for women. Have a beautiful day and be well.